Hi everybody, I've been asked to provide a short introduction to me and my research and background, and I'm pleased to do so. I am Joe Tomaka. I am a professor in the Department of Public Health Sciences. I also serve as the graduate coordinator for the MPH program. I also direct a small research center called Crimson Research. This is an applied research center where we work with a number of community agencies on projects that are based in the community. These projects typically involve program evaluation or survey research. I'm also vice chair of the New Mexico State University IRB, among other things. I'm from Buffalo. My background and my education is in psychology. I have BA and MA degrees in psychology, and my terminal degree, the PhD, is in social and health psychology, which I got way back in 1993 from the State University of New York at Buffalo. Buffalo is, I said, my hometown. Buffalo is famous for many things, most notably Niagara Falls, chicken wings, and the Buffalo Bills. Out of graduate school, I first worked at the University of Otago in Dunedin, New Zealand. That's it over on the right, the most beautiful place on earth. I then came to the University of Texas at El Paso in 1995 and was there until 2013 when I joined the faculty at New Mexico State University. I'm listing one research interest. I have several, but this is my primary focus and the one that motivates me the most. I am interested in individual differences in reactions to stress and have been for many, many years, decades even. The primary research questions that direct this research focus are several. There's three. The first is, I want to know, why do people differ in response to the same objective event, or a stressor, we might call it in this research area? So when faced with adversity, why do some people crumble and others thrive? And why are some people resilient and others less so? I also want to know if some stress reactions are better for us than others. Do they have better outcomes? Do they have better outcomes for us emotionally, physically, for our health? And lastly, related to this, I'm interested in the mechanism. What are the mechanisms by which stress reactions lead to health outcomes? And again, are some stress reactions better for us than others? The conclusion I've reached after many years is appraisal processes are key to figuring this business out, to sorting out these questions. And my research has shown that initial appraisals of events, potential stressors, vary on a dimension ranging from threat to challenge. At one end, threat appraisals are when the situation and the demands therein are perceived as exceeding our abilities to cope. These appraisals lead to feelings of distress and anxiety. They lead to behavioral withdrawal and poor performance, and they lead to maladaptive physiological reactions to stress. On the other end are challenge appraisals. Challenge appraisals are when situational demands, however significant, are perceived as within coping abilities. We can deal with them. Challenge appraisals lead to less stress and even positive emotion. They lead to behavioral engagement and enhanced performance in many situations, and they lead to an adaptive pattern of physiological response. My current research has been focused on this and these processes for many years. Most recently, we've been investigating research related to identifying individual differences in the tendency to appraise many situations as either challenging or threatening. That's all I have. My time is up. Thank you for listening.